Hello, I am here today to inform you that clinical psychology is but one of infinitely many perspectives through which a human being can seek to understand and make sense of oneself, others, and the world. It is a paradigm. It is a framework for understanding. It is by no means an absolute truth, nor is it a system whereby absolute truth can be studied, obtained, proven, discovered, or anything like that. Clinical psychology is neither good nor bad, positive nor negative, right nor wrong. It may very much resonate with you in the way that you see the world, yourself, others, and everyone who constitutes this reality, or alternatively, it may not resonate with you in how you see the world, and that is okay. That is perfectly okay. It is one perspective in the same way that science is a perspective, Christianity is a perspective, spirituality is a perspective, Hinduism is a perspective, Buddhism is a perspective, Judaism is a perspective, Western medicine is a perspective, Chinese medicine is a perspective, Ayurvedic medicine is a perspective. It is one of these many perspectives from which we are able to choose and learn about ourselves according to what resonates with our experience in the world. Now, as a graduate student in a doctorate clinical psychology program, I got in the nitty-gritty of the coursework, the introductory coursework for clinical psychology, and quickly learned that this was not something that resonated with me. Now, this may not be true of your experience, and that's okay. I'm just here to share my perspective and some of the challenges I've faced as a clinical psychology doctorate student. In clinical psychology, we all are studying abnormal psychology in terms of there being a normal way of functioning and an abnormal way of functioning, and people falling along this continuum of normality and abnormality. And we measure this or quantify it by an individual's experience of distress in their life, in one aspect, one or more aspects of their life. So maybe they're functioning at school, at the workplace, at home, in significant interpersonal relationships. And we also look at what kind of symptoms is an individual struggling with that are causing or exacerbating, worsening, contributing to the person's distress. And so we are taught to conceptualize people as being pathological, as acquiring a pathological pattern of behavior through their genetic predisposition, so through the genes they inherited from their parents, the very DNA that caused them to be a certain way, to have this underlying predisposition to be more vulnerable to developing a mental illness. So there are genetic, there are biological influences, neurochemical influences, all the chemicals in the brain, neurotransmitters, the way our pathways are arranged, how connective the different pathways are, as well as different social factors, environmental factors. So what was the family upbringing like? What is the person's interpersonal relationships like? What has the person experienced in their life above and beyond any kind of genetic predisposition? Okay, so everything that person has been through, the stress they've experienced, the relationships they've experienced, the kind of job they're doing, the kind of work they have, really looking at the day-to-day life over time. So psychologists make the assumption that there is such a thing as a mental disorder. Now, some have fought it, but still kind of play the game, right? You have to diagnose people to get reimbursed, so this diagnostic and statistical manual was created. The DSM-5 is the 5th edition of this manual of diagnoses that really is, in my opinion, or my perspective, right, one of infinitely many, it is psychology's way of trying to mimic and model itself off of the Western medical field. So you get a certain diagnosis, and that diagnosis determines the course of your treatment, and those treatments are all evidence-based, based on this diagnosis that has been studied and shown to be reliable or repeatable over time. We see it again and again over time, as well as valid. It is a diagnosis that is a valid category, right? We see it, we think we're able to measure what the disorder really is. So it is a thing, right? It's something, and we accurately are describing it and able to identify it and to treat it through evidence-based, so research-based treatments that we have developed based on a theory and studied. So psychology is really looking to model itself off of Western medicine, to be taken seriously, to be seen as a science, right? It is a soft science, a social science, kind of like sociology. So it's not a hard science like biology. And what we see in the field is a real insecurity about it not being so cut and dry. There's all this kind of gray area in the middle, right? It's not black and white. You're not either sick or not sick in the same way that it seems more clear in Western medicine, in physical medicine, that you either have a diagnosis or not. Clinical psychology is really concerning itself with making that distinction more crystal clear. So, we have this book, the Bible of psychology, right? Because remember, psychology is just another perspective. Clinical psychology is just another perspective. It is no more right or no more wrong than Western medicine, no more right, no more wrong than Christianity, no more right, no more wrong than Ayurvedic medicine or anything like that. It is but one perspective. And what I found is that it doesn't seem to be a useful perspective, a very holistic perspective. It's not a holistic perspective. It doesn't take the entire person into account. It conceptualizes a person as a cluster of symptoms with a particular history and genetic material that was inherited from parents, from one's lineage. So it's not taking into account someone's spirituality, for example. It's starting to, more so. And it's not doing a great job of taking into account a person's culture. Clinical psychology has been studied and propagated and created by white, European, educated, financially comfortable men. And it does not clearly or accurately know how to conceptualize someone who doesn't really fit that description. In fact, a lot of times, it doesn't really even accurately describe, conceptualize, or treat people of that description. So, what's going on here? The DSM defines a mental disorder as a syndrome characterized by clinically significant disturbance in an individual's cognition, their thinking, their emotion regulation, so how well they're able to experience and react and cope with their emotions. So sadness, anger, fear, happiness, surprise, disgust, joy, things like that. Or behavior that reflects a dysfunction in the psychological, so mental, emotional, biological, so a person's biology, a person's physiology, or developmental, so a person's growth and development across the lifespan, underlying mental function. And clinically significant means that it's basically something, it's like more than statistical significance. So it's more than we found it to be significant statistically on some measure of illness. So it's something that deserves clinical attention. And usually this is achieved by different rating scales, as well as a person's clinical judgment, a trained person's clinical judgment. So mental disorders are usually associated with significant distress or disability in social, occupational, or other important activities. So a person who's an alcoholic and is doing just fine because they're a bartender and, maybe they're single and they're not getting into trouble, that person would not get a diagnosis of, alcohol use disorder because they probably would never come in. Right? If everything's dandy. What brings people in is having some kind of disturbance like this, right? An expectable or culturally approved response to a common stressor or loss, such as the death of a loved one, is not a mental disorder. So your response to death of a loved one, being really sad, experiencing grief, anger, all those emotions, not a mental disorder. As long as you're being expectable, right? It's an expected response. It doesn't come out of the blue. Or culturally approved. So, as approved by dominant, mainstream, Western, masculine, educated, higher SES kind of culture, right? Very specific culture. Socially deviant behavior, whether it be political, religious, or sexual, and conflicts that are primarily between the individual and society, are not mental disorders, unless the deviance or conflict results from a dysfunction in the individual as described above. Now this is where I have a lot of trouble, because if it's a conflict between the individual and society, if that's not a mental disorder, how do we determine if it's just dysfunction in the individual? When all individuals exist, live, experience reality within the context of society. So, Clinical psychology, in essence, is saying that there's something wrong with the individual when you're giving a diagnosis. This dysfunction is coming from the individual. How can we separate the individual from society, from a person's context? That I do not understand at all. From my perspective, we're living in an extremely sick society. Again, I'm only speaking from my experience of mainstream dominant American culture. I've only ever lived in America. I've done some traveling elsewhere, but for the most part, I've been here. I've been living a very white, privileged existence. I've interacted with other cultural groups within the context of American society, but I'm coming from my own experience, right? We all are. And I think to make this arbitrary distinction between, oh, it's not the society's fault, this dysfunction is coming from the individual, how do you separate that out? That seems really arbitrary and like a very vague, imposed boundary. So, for example, we see all these kids having more and more diagnoses of ADHD and autism and things like that. Okay? We're seeing more and more and more and more and more and more, and it seems like no one's really doing well in the current education system. Okay? Doesn't seem like it's working. But we evaluate and diagnose a child with ADHD and try to medicate them or change their behavior in such a way that they are able to plug back in and fit in the existing system more effectively. I believe the rise in mental illness, the increase in the prevalence of these so-called mental disorders, is a function of a very sick society, a paradigm within which individuals go to school and then, when they're of age, go into jobs that we're not designed to live that way. I also think clinical psychology is making the assumption that mental disorders exist, that there are things. They're pretending like these are things that people have and creating a conceptualization of treatment based on a cluster of symptoms that can be observed, right? We can see it in people. You can see how these things kind of fit. However, it says nothing of the underlying cause, and as a result, people are dragged along through therapy that may last for years and given medications they might be on the rest of their lives, and they never reach a state of health or wellness or mental positivity, right? We're just trying to get them back to baseline, back to normal, okay? But what is normal? Normal is something we've defined based on a hypothetical normal curve or normal distribution based on scores in the population. So the idea is that most people fall within a couple standard deviations of the mean or the average score. However, this normal curve is a theoretical curve. It does not occur in nature. Okay? So normality doesn't exist. It is not something that exists. And yet, the assumption of normality is an assumption upon which this field rests. Okay? It doesn't exist. And again, these diagnoses, they don't exist. If you've been diagnosed with something, it does not mean you have something. If that resonates with you, okay, fine. You can wrap your head around that and act like you have it and go to treatment for it. And that treatment you might find really, really beneficial. However, if you're someone who receives a diagnosis and goes through psychological treatment and feels like there's something missing here, then you're right. This perspective might not be helpful for you anymore. I think it can be helpful for some people, but for others, it's simply not enough. And I think actually for many people, it's simply not enough. And it fails to understand the true depth and infinite nature of human potential. And I think overall, clinical psychology pathologizes that which it does not understand. Again, the tendency is to pathologize these patterns of behavior that scientists, people who subscribe to this perspective, do not fully understand. This book, the DSM, is very quick to admit that mental disorders are extremely complex and that research on mental disorders and our very understanding of mental disorders is evolving. So it even says, while the DSM has been the cornerstone of substantial progress in reliability, the repeatability of diagnoses over time, it has been well recognized by both the American Psychiatric Association and the broad scientific community working on mental disorders that past science was not mature enough to yield fully validated diagnoses. That is, to provide consistent, strong, and objective scientific validators of individual DSM disorders. The science of mental disorders continues to evolve. Okay? It ain't done yet. It's not all been figured out. However, the last 2 decades since DSM-4 was released, we have seen real and durable progress in such areas as cognitive neuroscience, brain imaging, epidemiology, and genetics. Okay, and they acknowledge that they're going to have to change this diagnosis system as new research findings are being made. However, we learn in research and statistics that the way research is done is that a scientist has a theory, an idea, a hypothesis that they want to test, explaining some aspect of reality, some observable phenomenon. And the researcher designs a study to test this hypothesis, this theory, and even run statistical analyses in such a way as to specifically test the hypothesis, rather than just see what may happen. The recommendation is to test the specific theory. So the research is only going to show whether or not there is support or no support for a theory. Okay? And the publication bias is this problem wherein only studies that show support for a theory are published. Because no one wants to read about studies that don't show support for a theory. We really, as humans, want to understand things. We want answers. We want specifics. And so we see this bias in all the published literature that, oh yeah, psychologists look for, test a certain theory and they find support again and again and again. And you may think, oh, well, this is all well and good, but it doesn't show the other side, right? That for every successful test of a theory, there's at least one other theory out there that has not had that same success or support. And again, that's with the assumption that science, that the scientific method is capable of accurately explaining three-dimensional reality, which may or may not be the case. Okay? So I just wanted to get you thinking more critically about these different professional and scientific fields that as a culture, I think we accept as face value. we are quick to place the expertise in someone else's hands, whether that's for our psychological health, our physical health. It's a person becomes a patient seeking answer and treatment from an external source. And I don't think that's necessarily a useful direction in which to go. As a clinical psychologist, as a therapist, depending on a therapeutic orientation, some therapists who I very much respect and admire seek to do nothing more than create the conditions wherein healing can happen. And that, I think, is a truly, truly beautiful part of clinical psychology, of psychotherapy. And I think that essence is something that can be extracted and utilized in all manner of situations. I think that's absolutely wonderful and beautiful and very true to facilitate healing, to bring about better, more positive, more functional, more adaptive mental, emotional, psychological functioning. However, this focus, there's an impetus to pathologize, to look for the negative, and that is a self-fulfilling prophecy. So if we're looking for, hey, which diagnosis is going to fit? We're going to see some diagnosis. We're going to see what we want to see. A cognitive therapist, a cognitive psychologist would be the first person to tell you that our expectations shape our perception and our interpretation of reality. Our very perception. The schemas we have, the mental structures we have, shape what we actually perceive. So of course, if a psychologist, a trained psychotherapist, has this mental disorder manual, stamped in their brain, they have so many different schemas set up. This is my schema for depression. This is my schema for schizophrenia. This is my schema, my mental organization structure for anxiety, and little sub-schemas for each of the different sub-disorders. They are going to be so quick to observe evidence that supports a given diagnosis. And again, the cognitive psychologist would say that just because you think it doesn't mean it's so. So just because you think someone has a mental disorder doesn't mean you do. Doesn't mean that's necessarily true. Could be true, could not be true. So I really want to empower anyone who's been diagnosed with a mental disorder to critically think about it for themselves. Does that ring true for you or not? What is your emotional experience really like? Are you afraid of what you're experiencing? Has fear brought you in to a hospital or a therapist's office or anything like that? Are you experiencing something and it's scaring you so much that you're seeking help outside yourself? Seeking help from the purest of intentions? And are you happy with what you're receiving? If you're happy with what you're receiving, then I invite you and encourage you to continue along that path. But for people who are not happy with what you're receiving, I would invite you to really look within, to really, first off, if your safety is in question, of course, utilize these services, right? That's okay, right? If it's really a matter of life or death, utilize services. If you're able to find a space where you are safe and Your life is not at risk. I invite you to look within, because that space is inside of you already. It may be very hard to believe at this moment, but it's within you. And that's all a real healer is going to be able to do for you, is to show you that that space is within yourself. Not medicate you into submission to fit into a society that is extremely sick and is creating conditions where disease and disorder are more probable, much more probable than good health and mental health, which of course are the same thing. I invite you to think about this and to decide, reflect upon whether or not clinical psychology is a healthy perspective for you. Because it's not an objective. It is nothing but another subjective perspective that seeks to reify and strengthen itself through the scientific method by proving that it is something after all. Okay? Does clinical psychology serve you? I will leave you with that question. There's lots to think and feel about. Okay?